Hi everyone, welcome back to my channel. I'm Dr. Cindy Wong, and this will be a short, brief video summarizing my pathology residency experience and any of my final thoughts on residency and like work-life issues. Like I've mentioned before, it's the first year is very tough, but it gets better. And especially towards fourth year, you feel confident about much of the things you do. People ask me, is pathology residency challenging? Residency is residency. It doesn't matter what residency you do, it's gonna be tough. It's gonna be long hours. But that said, pathology residency does allow for a good work-life balance in comparison to other residents. I feel like, yes, we work hard when we're on search path and we're on blood bank, but when we're on the other rotations where we're kind of really doing like an 8 to 5 day, you have the rest of the day off for yourself to do whatever you want. So there is a good balance of work and life, and I do enjoy it. That said, did I enjoy my whole pathology residency experience? No. Hence why I dropped half of it. Looking back, I mean, I really only saved myself maybe 6 months of CP, and I couldn't imagine sitting and taking that CP boards. It's just like, I couldn't care about any of this. So I didn't want to take it. And that's why I am AP only. I enjoyed most of my AP rotations. I really enjoyed Surg Path. It's really what I went to pathology for, is to do the tissue diagnoses. Do I regret doing pathology? Absolutely not. If I were to do this whole process all over again, would I pick pathology? Of course, because I can't imagine me doing any other subspecialty within medicine. Like I said, I don't regret picking pathology, and I really only am interested in a portion of it. So that's why I'm specializing in GI, because I really like GI, I really like Surg Path, and that's what I hope to do in the future, is find a job where I could sign out mostly GI and maybe I'll do some general practice, or, do just GI. That would be like the best, where I could just do GI and teach residents and teach med students. And, I wouldn't mind doing autopsy and teaching residents how to do autopsies. In terms of work hours, we do work hard when we're on like blood bank and Surg Path, but almost all of CP is 8 to 5 or even earlier. I think a lot of people who, when they're on chemistry or microbiology, they're done by 3:30. So it's pretty chill on CP. And I have to say, as an AP only who have to do more surgical pathology rotations, so basically more of the 80-hour work weeks, I'm kind of jealous of my CP only co-workers, because they basically come in 8 to 5 every day or 8 to 3 every day. And what can I say? I don't enjoy it. So even if that was me, I wouldn't enjoy my time doing it. I'd rather do that 80 hours than to do that 45 hours and hate every moment of that 45 hours. Given that, because if you're APCP and, you have the really busy and then you have the pretty chill, overall, our pathology residency is well balanced and you have a lot of work-life balance. And, we have a lot of residents who spend time traveling. Well, before COVID, we have residents who have children, and it's all very manageable. So that's definitely, like I said, a perk about pathology residency, is the work-life balance. Other questions I've been asked before is, if I was to do it all over again, would I pick my current program again? Honestly, that's really hard to say, because I've only have experience in my current program. I don't really know what it's like in other programs. I mean, of course, there's aspects of this program I love a lot, and there's aspects I wish it could be changed. I feel like I learned a lot in this program. Working with such renowned attendings was like a privilege. Because of how prestigious the attendings are, I get to see, a broader spectrum of cases. We're very good on the AP side, and we're also very good on the CP side. Also, the flexibility that my program offered for me to make a mid program career change, I wouldn't trade that for anything. Overall, I feel like I would probably pick my own program again if, I hear there's a program out there that has everything I described and none of the stuff I hate, then yeah, of course I picked that program, but like I don't know where that program is or if that program even exists. So I'm pleasantly happy about my program as it is. Oh, I forgot completely in the previous videos about talking about pathology residency calls. So I had mentioned before in pathology, all of our calls are a home call. So we're not required to stay in the hospital for any of our calls. Most of the things, like I said, could be done over the phone. You just you access Epic remotely or you access Copath remotely, and you can answer the questions right there, right then. There are cases where we have to come to the hospital to handle the calls. In AP, that would be frozen sections, and that usually is overnight frozen sections. It doesn't happen that often. I would say we get these frozen calls maybe like once or twice. So we do call for a week at a time. During that week, I would say on average, there be no calls or at most 1 to 2 frozen calls throughout that whole week. And that's really it for call. In terms of the AP side, cytology, there's no call. Once the attending leaves at 5, we're done for the day. There's no weekend FNAs. And on autopsy, you might get a call from like Gift of Hope asking like, hey, can we coordinate with you about getting like donations for skin and bone and tissue before you start an autopsy, like that kind of thing, where you could of course address over the phone. But you know, the person who is on call is not in charge of doing emergent autopsies. We do autopsies during regular work hours, and on the rare occasion when you're on autopsy, you might have to do a Saturday autopsy. Given that I have done 6 months of autopsy, I have never done a Saturday autopsy. So that says how rare it is. And that's really it in terms of AP call. CP call is the majority of our residency calls. Majority of them is blood bank. The blood bank resident will take the calls on the weekends. And for blood bank, when we're on call, we're only in charge of the weekends because the blood bank resident does the weeknights. There's also calls for like critical values in chemistry, critical values in heme, and our responsibility is to help the techs to get in contact with a clinician. And if for some reason the techs can't reach anyone, then it falls onto us to reach a clinician to report the critical value. Honestly, I don't know how important this is because most of the time the clinicians will be checking the critical values anyways. And most of the time by the time we reach them, they're like, okay, sure, we already know that, thanks. So yeah, when you're AP only, you only do the AP call, and when you're CP only, you do the CP call, which is basically all of it. If you are APCP, we only do 9 weeks of call in all 4 years. That said, technically it's only 3 years because we don't like to have first years take any call. So we only have PGY2s and on take it. So you have, as APCP resident, you only have to do 9 weeks in 3 years, which is really not that much at all. All right, and that's it for pathology call. Like I said, not much brings up a pathologist to the hospital overnight. Though I do want to talk a little bit about residency burnout. I definitely experienced it, where even it's something I enjoy doing, it was so much to a point where I just don't want to do this anymore. And I get like very cranky, and it affects my like life and my interactions with other people, and I will close down, and I was like, I don't want to hang out with anyone, I don't want to talk to anyone, I just need to be alone. That is something that I definitely experienced in my residency, in my 4 years in residency, and it's something I experienced on a cyclic thing, where if I do several tough rotations in a row, I would definitely feel the burnout, and it will go away when I do, chiller rotations. There's a lot out there going on about residency burnout and how it's increasing, and I really can't say much on that. That all I can say is it's true. I experienced residency burnout. I expect that I'll probably experience burnout as attending too. It's just something that we because we're doctors, we have stressful careers. I feel like it's probably something that's unavoidable. Even with like the wellness programs that the GME for have set up for all residents, I feel like that it's like a bandage on a broken tank. It's somewhat helpful, but burnout's going to be happen. And honestly, I'm not sure it's preventable because, like I said, as doctors and as residents, we have very stressful jobs. And I guess this kind of leads to the last thing I kind of want to talk about in terms of residency. So during residency, I got halfway through residency, I got diagnosed with depression. And I just want to share this real quick because I feel like there's probably a lot of residents, even med students, who are experiencing MDD, and they're just not, seeking out help because they feel like, oh, it will look like I'm weak, or this is something just normal because, well, like I said, I experienced burnout, and there's this blurring between your burnout symptoms and symptoms of depression. And I think at one point I was just like, no, this is just what I am. I'm just never really happy, and this is just who I am as a person. When burnout is no longer burnout and it's depression, is like, for me, was when I started thinking about suicide. I would sometimes be walking to the grocery room and I would see an ambulance speed by. I'm just like, maybe if I stepped in front of that ambulance, this will be all over and I don't have to worry about this anymore. And I thought that's just how normal people view life when they're like sad and burned out. And turns out my husband's very supportive. He insisted I go see someone, and yeah, turned out I have depression. I did go through therapy, and I am on medication now, and everything is more manageable. I'm not saying this so you could feel pity for me or anything like that. I'm saying that so other residents, med students, even if you're a doctor or attending, if you feel like something is just like burnout, but like way more than burnout, it's not shameful to seek help, and you should seek help, and you should let people around you know. Because I've told my co-residents about my depression, and none of them judge me for it. None of them think I'm weak, but they're all supportive and understanding. And I told some of my attendings this, and they're also very supportive and understanding. I guess I'm just trying to say is, if you think you need help, please go look for it. We're all, as residents, as doctors, we're all a supportive community, and there's just some biases that we need to just look beyond and do what's really benefit for us. Because if we're not in a good mental state, our health is not in a good situation, we can't do our jobs efficiently, and that would in turn hurt patient care. And that's the thing we're all being doctors for, is there for our patients. Making sure you're healthy is also just as important as making sure you're treating your patients. I think that's it for this video. Please let me know if you have any questions at all about any of the videos in this residency experience series. Let me know down below. If I get enough questions, I will do a video answering all of the questions in one go. So yeah, please leave as many questions down below as you possibly can. And I hope the series was overall helpful and educational. And I hope, I didn't scare you guys off with my sad story in the end. If you enjoy my channel and my content, please like and subscribe. And I will see everyone next time. Bye!